I came for the training because I kind of reached a point in my practice where I've been practicing biologically for 5 years, slowly transitioning from safe mercury removal to surgery, cavitation, ceramic implants, doing it a lot on my own. Also building an offering that's under extremely high demand in our area, but getting burned out. And so just trying to do too much for too many, being everything to everyone. And I needed a shift. I needed to step back. I needed to look at things for the future a little bit differently. I wanted to try to get back to seeing fewer people, reaching them, treating them, helping them at a deeper level. And I thought this provided the perfect opportunity, and indeed it did. Well, I think there's, fantastic background on the online education. I mean, I've never been in so much depth in such a concise fashion, a usable and actionable fashion for the nutrition component of the course. And so preparation for coming here, that knowledge is invaluable, but seeing it in action, being here, experiencing it is a wholly different experience. To be able to experience it as a patient, see it as a practitioner, really allows me to go back and remain connected to what happened here at multiple different levels, speak with my patients more knowledgeably, more intimately about the experience, the things that we're talking about, and just give me more confidence also in speaking about it with them, since they know I've been through it, I've done it, so I wouldn't recommend anything to them that I haven't done for myself. So I brought April along from our practice, and whereas I like to think big picture and connections with people, she's really into the details. So to have both of us see it, we feel like that's the strongest strategy to go back and implement the minute we get home.
How I can be a supporting role for the clinical protocols and the patient preparation and just a more solid understanding of all of the steps and the complexities that go into a fully encompassing biological protocol. How well the patients were doing immediately after the surgeries with all of the supporting protocols that get integrated, into their full course of care.
I think anytime that you feel like you've reached a point where you're stuck, and you want to get moving forward again, so that whether that's um, you've reached a point where your practice is overwhelming and you're experiencing too high of a demand, like I am, looking for that path forward, to get back to a point where you're reconnecting with people at a deeper level. I think that would be the perfect time to come. I can speak for that from my own experience because that's exactly where I was. But I think anywhere along the way, no matter what stage you're at, um, maybe you can avoid some of the frustrations that some of us have had or that I have had in building a practice that way. So I think no matter where you are, um, it's a good time to start.
As a team member, I think being able to see it in person is a much better level of understanding than even what I gained from watching the videos and the learning modules or even hearing the information secondhand. That I'm a very in-person learner, so I have to see each methodical step to really gain a better understanding of it.
I'm big picture. April gets the details. Bringing it back to our team, that's two different perspectives. So rather than just hearing me say things all the time, to hear it from her, is a totally different level of connection with the team in particular. So 100% do it this way again.